Good morning. First of all, let me thank the organizers, the administration for giving me this opportunity. So, I'll be talking about fever, the common myths, and what exactly is the fact. Okay, so before starting, let me say I would like this to be a more interactive session rather than a monotonous lecture. So I expect questions from you because fever is something which we face day to day. Either we will have fever or somebody in our family will have fever, especially children will have fever. So we will encounter fever daily. We ourselves know about many myths. But when I searched through the internet, there were a lot of questions that were asking about so many things about fever. So there are so many myths. So covering all the myths may not be possible. I will try to talk about few of them. So what is fever first of all? So fever is normally we have a body temperature which is say approximately 98.4 degree Fahrenheit. And it can fluctuate 1 degree to the both sides. So a 1 degree fluctuation is not a fever, but a temperature above normal is said to be fever. So causes of fever, there are a lot of causes. Infection may cause fever, lot of inflammations may cause fever. Inflammations other than infections can cause fever. Many even cancers can cause fever. So there can be many significant diseases that can cause fever, or many insignificant diseases that can cause fever. So let us go to the myths. Okay. So one important myth is that fever means it is something bad to health. But what is the fact? In fact, fever is not bad for health. So, what body actually does is it raises its temperature in an infection so that its immune response or immunity is boosted. So, when the fever is there, that is temperature is increasing, the immunity gets boosted. So, the immune system acts better. That is one reason why we have a fever. And second reason is that our body can still function with a little higher temperature, but the viruses and bacteria may not be that much able to survive in a higher temperature. So actually fever is a protective mechanism. So should we treat a fever? That myth will come later. So fever is not always bad for health. Fever is actually a response which is good for health. It's not a bad thing. So the myth is that all fevers are bad. They are not bad. Next, there are a lot of myths about fevers with seizure, that is fits. Fever on the fits. Fever the fits. Actually, seizures are not common in adults with fever. Fever adults seizure ரொம்ப unlikely. Very unlikely. It's a very unlikely situation that we get seizure in an adult due to fever. But whereas in a child can get seizure. A child can get seizure, that is 6 months to 6 year age, that is the age at which a child can get seizure due to fever. But up to seizure if there is a seizure, if child is getting a seizure, is that bad? It is not by itself bad. It is not going to continue as a seizure disorder. It's not going to damage the brain as such if they had just one seizure episode due to fever. It's not damaging the brain or anything. So, but it is always better that we treat that fever and prevent, especially this age group or somebody who is less than 6 years, we can treat the fever at least to prevent seizures. But all seizures are not bad. All patients who get fever will not get seizure. It's common in children, and among the children also the incidence may be 1 in 30 only, not everyone. So fever is not associated with fever. High fever doesn't mean seizure. So if there is a seizure associated with a fever in an adult, we think about other diseases. Maybe there is a meningitis, there is an encephalitis, something else is there. So if an adult is having seizure with fever, it is not due to fever, there is something else underlying. Next is, every fever needs antibiotics. This is absolutely wrong, and we always follow. Even I have seen doctors following this. Fever vanda udane oru azithromycin illana oru amoxicillin oru edo oru antibiotic. Fever vanda udane antibiotic. Most of the fevers which we encounter are due to viral infections, and none of the antibiotics will work in viral infections. So ultimately, at the end of the day, using antibiotics for fever is just waste of money, waste of resources, and damaging your health. So you don't need to use antibiotics for routine fevers. Majority of fevers do not require antibiotics. So possibly in my prescriptions, most of the people who are coming to me with fever, most of them will be going back without antibiotics. Unless otherwise I have a proof like a yellow colored sputum. Patient is saying that there is an yellow colored sputum, or if the counts are elevated, you don't need an antibiotic. So all people who come to you with fever, you don't need to give them antibiotic, and if you have a fever, you don't have to start antibiotic. Taking a paracetamol is more than enough, if needed, because all fevers does not need treatment either. Next is, high fever is dangerous. It is not that high fever is dangerous. It is what is associated findings with fever that is more important than an actual value of temperature. If the temperature is say 103, doesn't mean that the patient is having a significant or severe disease. 103 can be simple common cold, common bacterial, common viral infection. And whereas a fever of 100 or 99 may be typhoid. So 99 or 100 may be typhoid. So the actual value of temperature does not mean that the patient is having a significant disease. Of course, the patient will come to you if there is a high temperature, and patient will not come to you come to us if the temperature is low. That is there, but it doesn't mean that high temperatures are always dangerous. There is nothing like that. To bring down the temperature, how much we should bring down the temperature? See, if you give paracetamol, you will be reducing the temperature by 1 degree usually. The routine doses of paracetamol may reduce the temperature by 1 degree. So if the patient is having 104 degrees temperature, you are giving one paracetamol, that may reduce the temperature to 103. It may not come to normal, and it is not required that you should bring it to normal. It is more important to maintain the hydration. It is more important to relieve the pain, whatever pain they are having, and this paracetamol can do that, relieving the pain. You don't need to bring down the temperature to normal. That is not required. So you don't have to worry about the actual value of temperature. And the temperature value of the you can reduce it by 1 degree with paracetamol. 1.5 degree varaikkum go maximum. 2 degree ku mela pogave maximum paracetamol kodutha. Adukku mela paracetamol kodukradhu useful ah irukadu. It may affect your liver. The more you give paracetamol, the more chances you may get liver toxicity. Paracetamol koduthala edutha adu prachane da. So minimum paracetamol to relieve pain, maintain hydration, that is enough. High temperature is not always dangerous. Of course, high temperature may mean that there is a significant infection, maybe pyelonephritis irukkalam, adu maariyulla infections irukkalam, but that doesn't mean that high temperature is always equal to a dangerous disease. Sometimes we can get even dangerous diseases with a low grade fever also. And this we already talked. Temperature is important. Temperature is not important. It is the patient's hydration, patient's toxic look, and patient's vomiting, other symptoms. Those symptoms are more important than temperature. Temperature and temperature value, this 102, 103, that is not important. Overall patient's look. The blood pressure is important. The pulse pressure is important. Pulse rate is important. All these things are important. Whereas the actual value of temperature is not that important. And this happens many times. People will have a thermometer and they will measure the temperature frequently and they will report that they are having persistent fever. Temperature 98.7 to 100. This can be normal. 98.7 to 100 can be normal. Anybody can have that temperature. And remember, all females at the time of ovulation will have a higher temperature. That is also not fear. They will have a higher temperature at the time of ovulation. And even otherwise, diurnal variation is there. Day to day temperature varies and there is a variation in temperature every day. So actually this is not a fever, this is just a variation in temperature. And if you are otherwise doing well, perfectly well, this is not a fever. And this has been a saying that is there for maybe centuries. Feed a cold, starve a fever. So actually what will happen in fever, just imagine, during fever your metabolism is increasing. So you need actually more calories than what you actually need when you are not having fever. When your metabolism is increasing, the thermostat is kept at a higher level and to maintain that, the body is doing more work, the more muscle, that is shivering, all those things may happen, and there is a thermostat kept at a higher level which increases the metabolism. And there is increased metabolism that is maintaining a higher temperature. So you need more calories during fever than when you are not having fever. So starving a fever is not an option, ideal option. Ideal option is to take as much as possible nutrient foods, take high calorie foods and take lot of fluids. Of course, we know that whenever you have a fever, there is loss of appetite. You are not able to take much food. So loss of appetite is there. Pasi recur. So you will have to take good quality foods. Lot of fluids. So Kududala, you are taking fluids. So fluids with better calories, good nutrients. So it is not like you have to starve a fever. Then these are few slides which I prepared. Not I prepared, my PG prepared for me. She only collected the pictures. But there are many other myths. One important myth we usually see, because we see a lot of dengue patients. People are always worried about platelet counts. So everybody, when they get admitted or when somebody they known to them get admitted, they will call and ask, platelet count all. They are always worried about platelet count. But remember, platelet count as such is not a reason for fatality in most of the dengue patients. It is not a reason for fatality. And low platelet producing anything like a stroke is also not very common. It can happen, but such low platelets causing strokes also we see very, very, very rarely, seldom. To be more specific, seldom we see. So platelet count is not actually the thing. We are more worried about hematocrit, that is the blood concentration, hematocrit. We are more worried about the pulse pressure, that is the difference between systolic and diastolic BP. The narrower the pulse pressure, more significant is the disease and more likely that patient may develop any complications. And we are more worried about the systolic BP, and when the BP is low, we are more worried. We are more worried about the WBC count also, because WBC count is the one which goes down first, and if once the WBC count starts recovering, platelet is also going to go. So platelet as such is not a cause of mortality. It is actually many other things that matters. Then, and how much should we treat? So the other thing is, once we treat a fever, it should not recur. There is nothing like that. If you give a paracetamol, its effect lasts for say 4 hours to 6 hours. And once the effect weans off, the fever is bound to come back, because the thermostat is kept at a higher level. The fever is bound to come back. So even if you treat a fever with adequate drugs, once the effect of paracetamol goes off, the fever will come back. So that doesn't mean that there is something else going on. Nothing like that. It's the existing viral infection or whatever it is. Then very high temperatures are bad for brain. True. But remember that none of the fevers are going to make your temperature that high. Then another thing is, we are always worried about the numbers, especially in children. So I don't see much of pediatric cases, but sometimes in clinic patients come to me. So the child will be happily running around, but the parent is worried. When the child is active, child is feeding properly, there is nothing to worry about the actual value of fever. And there are many studies which say that there is no point in treating that patient with any paracetamol. You don't need to treat that child who is active, who is not having any limitation. Don't treat that patient even with paracetamol. Okay, so now I think we will have questions from the audience. I talked about few of the myths. Maybe I have left many myths back, so you can ask questions.
Please feel free to ask questions.
Happy morning, sir. Beautiful explanation. So, in a nutshell, we understood that not necessary to give paracetamol immediately. Is it how long it can remain safe without giving paracetamol? How long we can wait?
Okay. So the use of paracetamol basically is to reduce the suffering. So whenever the patient is having sufferings, use paracetamol. Don't hesitate to use paracetamol. That is pain irritant, use paracetamol. Body pain irritant, you can use paracetamol. But my intention was to tell you that paracetamol is not meant to reduce fever, it is to treat the sufferings. So paracetamol can be used. There is no harm in using paracetamol, but that is not to reduce the fever, it is to reduce the sufferings. Actual treatment of fever is by giving adequate hydration. And if you have a fever for 3 days or more, please visit a doctor.
Thank you, sir.
Thank you, sir. Please give your advice on using papaya leaf extract in patients with dengue fever very commonly.
Okay, we have been seeing this quite often. People giving even papaya leaf extracts. Okay, papaya leaf extracts are commercially available. They are more purified and refined, and they don't produce any gas pains. But what we actually see is people get the papaya leaves, they grind it and give it. So what we actually see is people comes back with vomiting, diarrhea, all those things. Secondary to this, papaya leaves contains lot of enzymes. Papaya is one of them, which is a protease. So these things can do more harm than good sometimes. Of course, there are some studies with small number of patients. One study is from Venkateswara Medical College, Tirupati, which says that people who received papaya leaf extracts that did better than the people who didn't receive papaya leaves. But the numbers were very small and the statistical significance was little doubtful. So there are no concrete studies which say that papaya leaf extracts are good. And another thing is kiwi fruits. இந்த டெங்கு வந்துருச்சு, இந்த பழக்கடைக்காரங்கெல்லாம் அவன் எல்லாம் ஆளாளுக்கு வந்து கிளப்பி விட்டுருவாங்க. கிவி ஃப்ரூட்ஸ் சாப்பிடுங்க, அதுக்கு முன்னாடி வேற ஏதோ சொன்னாங்க, இல்லைன்னா அவகாடோன்னு சொல்லுவாங்க. எந்த ஃப்ரூட் செலவாகாம இருக்குதோ அந்த ஃப்ரூட்ஸ் நல்லா இருக்குன்னு சொல்லுவாங்க. நீங்க அது நிறைய பேர் வாங்கவும் செய்வாங்க. There is nothing like that. Hydration will improve your brain incomes. So it is ultimately hydration. Ultimately what happens is you take papaya leaves, you vomit, you have diarrhea, and finally hydration is low.
Happy morning, sir. It might look a little funny to ask, but really would like to know. During summer and winter, we supply lots of ice cream to children. And there is a myth that if we give ice creams, children get fever. So you give hot water after giving ice cream. Is it really a myth? And still these talks are going on in and around.
Usually, it's not really a myth. Whenever there is a sudden change in temperature, the bacteria can invade your system. So that is the fact behind ice creams producing throat infection. So it's not a myth. So everything that is said is not a myth. Ice creams, of course, it's not just ice creams. Anything that is cold will produce a sudden change in the temperature, and this sudden change in temperature can facilitate the bacteria to enter the system.
Good morning, sir. Sir, during chicken pox and all, we get fever. So there is a myth not to take any medicine at the time of chicken pox. Shall we take or not?
Okay. So chickenpox of course will be self-limited, and you will recover from it in a period of say 10 days. But the problem is that, especially females, you will have a lot of scars. When new crops go on coming, there will be a lot of scars. You can see a lot of scars on my face also. Because I didn't take any medicine because my parents were told by somebody that you should not take medicines. And ultimately somebody came and gave some homeo medicines. I'm not blaming anyone. Actually, I had lesions even on my palms and soles. But I recovered without any issues. But if you are taking medicines, the sufferings are less. You will get lesser number of crops. Even when the crops are there, the number of lesions will be less. Your chance of getting scars, everything will be less. So suffering will be less.
Okay. Even now, this type of myths are going
Yeah.
on.
So using antivirals in chickenpox will definitely decrease the duration of illness, decrease the number of lesions, decrease the number of crops.
It is good to take.
Yes, it is good. And of course, in chickenpox, when you are giving antivirals, you are reducing the chance of complications like either viral related pneumonia or secondary pneumonia. So all those things you are reducing.
Hardly everybody knows what is a stroke. Stroke is a brain attack. Like what we see, heart attack is very well known, but stroke is often confused with heart attack. Many people think that stroke is the same as heart attack, but stroke is the other name for brain attack. Heart attack occurs when the blood supply to the heart is decreased. The similar way, we get a stroke when the blood supply to the brain is decreased or it is decreased. So, who all will be getting a stroke? Anybody over the age of 60 were getting strokes earlier, but nowadays the strokes are starting from the age of around 40 to 45. All these days we have a protocol called code brain in our hospital. So they will be telling us so and so patient will be admitted and previously the age of the patients will be around 60 to 65, but nowadays the age of the patient is around 40 to 50. So the age of the stroke has come down. So that is why this topic we have chosen to make you all understand the importance of stroke and what treatments are available and why it is important to treat a stroke early. Why? First of all, why is it important to treat a stroke early? Strokes are very important because it will cause a damage to the limb. One side weakness. Stroke other name is Pakkavadam in Tamil. Pakkavadam, no, one side, the weakness of there might be weakness of the one side upper and lower limbs, or there may be speech difficulty, or they can have loss of vision, they can lose some balance, or they can become comatose. These are the main symptoms of stroke. So, if a patient catastrophically develops these symptoms like weakness of limbs or coma or speech difficulty, and if the patient is the earning member of the family or the mother of the family, just imagine how much effect the effect will be there on the whole family. So once the earning member of the family is affected with stroke, the hospitalization itself will be around 10 to 15 days, and after that the patient will have mild weakness or sometimes more weakness. Patient might be bedbound. He might need physiotherapy, the treatment cost and everything. So always prevention is better than cure. So we have to see to that we prevent getting a stroke, or once we get symptoms of stroke, it is ideal that we reach the hospital very early to treat the stroke. So once if you come to know if any of your neighbors or relatives are affected with weakness of limbs, or side kai kaal varala, not able to move, or if they are having some different sensation or a numbness of the hands or the limbs, and the weakness or if the patient is suddenly not talking, speech difficulties or if the patient is having suddenly becoming comatose, or if the patient develops a seizure, fix or if the patient finds it difficult to walk, நடக்கும்போது ஒரு சைடு தள்ளாட்டமா பண்ணும்போது difficulty is there, then we need to consider stroke. So these are the symptoms. First, that is face drooping, arm weakness, speech difficulties, and if you find any of the above, we have to consider stroke. Now they have added two other things called any difficulty in balancing, or if there is any weakness of the vision loss. All these we should be very vigilant, and we should immediately go to the hospital. The problem is the risk factors of stroke. Who will all get a stroke? Patients with diabetes can get a stroke very commonly. Patients with hypertension, patients who have cholesterol, or patients who have cardiac problems, or sometimes patients with valvular cardiac problems can get stroke. These are the main majority of patients who are associated with stroke. So patients with diabetes, these are the more difficult patients to treat too. And when they develop stroke, what happens is most of the family thinks that the stroke is because of hypoglycemia. They think that the patient has developed hypoglycemia, and the patient is retained at home, thinking they give some sugar water. They just take the patient to a nearby hospital, and they waste the golden hour of treatment of stroke. So in those cases, after they find out that the stroke is not improving, the weakness is not improving, then they come to a comprehensive stroke center like ours. This is the golden time that we lose. I would like to make you all understand that as soon as the weakness is seen or found, it is better to take the patient to a best nearest comprehensive stroke care. Ours is one of the best, and we need to bring the patient directly here and not to any nearby smaller hospitals where time will be lost. Because even here, once the patient takes at least 1 or 2 hours for you to reach the hospital. Once we reach the hospital, we examine the patient and we do a CT scan or an MRI brain to find out what is the stroke. So once we find out the stroke, then we need to give some injections like clot busters so that the patient is immediately treated. So the time interval for stroke treatment is 4.5 hours. 3 hours to 4.5 hours is the best treatment for stroke, best time interval for treatment of stroke. So if we miss that golden hour, most of the neurons will be lost by that time. Every minute, every second, we are losing 12 million neurons in our brain. So imagine for 4.5 hours, if it is delayed, how many neurons will be lost. And after that, once the neurons are lost, we are not going to regenerate them. Only the nearby neurons will take over the function of these neurons and we will get the power back. Will be getting the power back. It is not possible mostly if the patient does not come to the hospital by 4.5 hours to get the normal power strength of the lymph weakness which is lost. Because already so many neurons are lost and the nearby neurons have to be healthy and functional to take over this function of the lost neurons and the power to be gained. If we lose that time, we lose the neurons. That is why this eponym called Be Fast. It does not only tell the symptoms of stroke, but also this acronym tells that we have to act very fast. And that is why all major hospitals, including ours, have started a comprehensive stroke program, and we are trying to take the time interval at what time the patient comes in and what time we thrombolize, and we are trying to improve it every day. So from your side, once you know if anybody's got a stroke, best is to rush to the hospital immediately. So there are two types of strokes. One is an ischemic stroke where the blood supply to the brain is blocked or decreased, and other one is the hemorrhagic stroke. And another one is the hemorrhagic stroke. So ischemic stroke occurs in patients with diabetes, hypertension, cardiac disease as I told, and some very common cardiac disease called atrial fibrillation, where the heart will be very fastly beating and that will result in embolic stroke. This ischemic stroke is the most common, and around 80% of the strokes are caused by ischemic strokes, and less than 20% is hemorrhagic stroke. So ischemic stroke is due to blockage and hemorrhagic stroke is because of bursting of the blood vessels. So bursting of blood vessels can occur. When can we have the blood vessels to burst? It is mostly due to hypertension. When we have hypertension and the blood pressure is uncontrolled, and when the BP goes above 170, 190 at that rate, we can get a stroke. That is because of the bursting of blood vessels inside the brain. It's all right. So that is the. So those are the two main types of strokes. One is an ischemic stroke due to block, and other one is a hemorrhagic stroke due to bursting of blood vessels. So ischemic, all these treatment that we were talking about is towards the ischemic strokes. So ischemic strokes we need to treat early. So what options do we have to treat the ischemic stroke? We have clot busters. We have some injections called tenecteplase and alteplase, which we will be giving within 4.5 hours after the onset of stroke. 4 hours, you have to come within 3.5 hours, and then we will be able to investigate the patient that will take around 30 to 40 minutes, and then we need to give the injection. So this time is very important. So we will give the clot buster, and that clot will lyse the clot, which that injection will lyse the clot which is inside the blood vessel in the brain, and the blood flow will be restored. Only if the blood flow is restored within 4.5 hours to 6 hours, there will be some improvement in the body within the weakness. Otherwise, the patient's weakness will remain as such. I'm sure you would have seen patients with weakness walking in wheelchair or with a stick. All those patients are probably they have come late or not have been treated with such a clotbuster injection. So these injections are not very costly also. They cost around 30 to 40,000, and they are so much life saving and limb saving. And these once given within 4.5 hours, nearly 70% of patients will recover, and they will be able to lead at least a near normal life. Actually, we do have one of our professor. I think he's an associate professor in SNR College. He was around 35, 37 years when he came to us with stroke. He presented late. He came after half a day, and we were not able to thrombolize him. He was a diabetic. He was not. He was a newly detected diabetic. We only found that he had a diabetes, and so it was his high diabetic value that caused the stroke. And we were not able to give him the clot bursting injection. But the remaining treatment we were able to give him, and now he's again joined Ramakrishna College again. He's in some department of commerce or something, and he's back to his work. Had he come before, the number of days lost in his leave and all that would have been better. So that is very important. So the ischemic strokes are treatable once we come very early. So the early, the better. That is the motto, and that is what we want all of you to understand. And any patient with a stroke, ischemic stroke, can be treated. And we do have another method. Our hospital also has something called thrombectomy. So what is thrombectomy? This is the second treatment that we will offer to patients with stroke. What is thrombectomy? So we do angio for the heart, we are able to do angio for the brain also. So once the clot is not lysed with the injection that we give, we do an angio through a peripheral vessel. The radiologist does an angiogram, and he will go remove the clot and come back. So the clots will be removed from the brain, and the blood flow will be restored. So this is also available in our hospital, and this can be done within 6 hours. So that time interval is a little bit prolonged, and within 6 hours, if you are able to undergo this procedure, I'm sure that we will be able to offer a better life to the patient. The other type of stroke, that is hemorrhagic stroke, that is because of the bleeding inside the brain. When do we have bleeding inside the brain? When there is some hypertension which is uncontrolled, or an aneurysm, something called an aneurysm, we have a bleed inside the brain. Aneurysm is a small bleb that happens inside a blood vessel, and that bursts, and that results in bleeding. And the treatment for both the aneurysm and hypertension, maybe the surgery might be needed for the hypertensive bleed to be evacuated, and for the aneurysm we will be able to do a radiological blocking of the aneurysm, or we can open and a patient can undergo a surgical repair of the aneurysm. All this is also available in our hospital, and we are doing it quite frequently. So, but the catastrophic one is the hemorrhagic stroke, because patient at presentation itself will be very sick, and the ischemic strokes are easily treatable better, and we have time up to 4.5 hours to 6 hours. If they present early, we will be able to treat. So what can we do from our side? What we do? We try to educate like this for patients to come early, and we offer good treatment here like thrombolysis and thrombectomy, and we do have a good physiotherapy unit here which takes the rehabilitation well. And this is from our side. What to do from your side? In case if you see anybody with stroke, please identify them early and bring them to a comprehensive stroke care center and treat early. Please don't take them to a nearby center and waste the golden hours of stroke. Today we had a patient in the morning who was good enough to, the attenders saw the patient at 4 o'clock. She has developed weakness of her left upper and lower limbs. At 4 a.m. they had seen.
She had slept at 1 a.m. She had got up at 4 a.m. to feed the small kid, her granddaughter, and she found that she was not able to move her left upper and lower limb. They came here by 7:30, and we have thrombolized her by 8:20, and she is now able to lift. I had actually brought that video only, and she is able to move the left upper and lower limbs.
A very good morning to one and all present here. I'm Dr. D. Ramakrishna, working here as consultant brain and spine surgeon. So when the marketing team and management asked me about the topic, I chose to speak under the topic demystifying the brain. Basically, there are a lot of issues that can happen in the brain. Many people suffer from brain trauma. Many people suffer from tumors. But there is a lack of awareness about the diseases. And also once people are getting diagnosed with diseases, there is significant delay in taking decisions. So in this presentation, I will try to explain you about a few patient stories and a few cases that I have seen in the last 8 years, and I will try to summarize the important points. So just to start with basics of the brain, as we all know, brain is a complex organ that is responsible for our motor skills, sensation. It controls our behavior, emotion, temperature, breathing, almost everything. Together, the brain and the spinal cord is called as the central nervous system. The major parts are cerebrum, cerebellum, and the brainstem. The brain has two hemispheres, the right and the left, and each hemisphere has specific function, at least in 90% of the population. The left brain controls analytical and logical thinking, language, science, and math skills. The right brain controls intuition, creativity, and arts and music. Each hemisphere is made up of 4 lobes, and each lobe has specific functions. The frontal lobe controls the motor skills, personality, and behavior. Parietal lobe receives all the sensations that we receive through the special senses. Occipital lobe receives the visual functions. Temporal lobe contributes to memory. A stitch in time saves 9. I will begin by talking about this specific scenario. 2 different patients of the same age group. One patient was very close to my friend, his grandfather. He was 90 years old and he suffered from bilateral SDH. SDH means subdural hemorrhage. This is a bleeding that happens between the brain and the skull. So he had this bleeding on both sides of the brain, and he was hospitalized in a good hospital in Coimbatore, and he was advised surgery. He asked me an opinion. I also suggested the same. But they were very skeptical, confused. They delayed taking decision, and they didn't undergo surgery. The simple reason was he's 90 years old. He has already lived his life, so everything is done, sir. So I'm not going to do anything. And eventually he died. So in the same week this happened, we operated a case, 92 years old male in this hospital, and this was the MRI. So the patient had bleeding, the same radiological image, the same age group, and the patient walked back home after 5 days of surgery. So this is what makes the difference. Decision making is very important once a specific diagnosis is found. Age is not a matter in brain surgery, and the patient can have very good outcome. I'll be talking about the certain brain pathologies. To summarize, these are the pathologies. The most common that we see here are trauma. Road traffic accidents contribute a significant volume of the patients coming here. Tumors can affect the brain. Vascular lesions, the lesions affecting the blood vessels. It could be a stroke, aneurysm, or AVM. Infections can affect the brain. Autoimmune disorders, degenerative and congenital disorders are other pathologies. This is one of my favorite pictures from a book called Roten, a neuroanatomy textbook. This is a perfectly dissected brain with blood vessels, both arteries and the veins. Arteries are in the red color and veins are in the blue color. So you can see how beautiful and good the brain looks, and I will show what happens after trauma. So there are 3 patients here. The first patient, 60-year-old male, he fell from two-wheeler, skid and fall from two-wheeler. He was not wearing helmet, and he sustained what we call EDH, or extradural hematoma. There was bleeding between the brain and the bone. We didn't operate on him as the bleeding was very small, and we managed him conservatively with medicines only, and he was discharged. Second patient, the same story, fall from two-wheeler, 35-year-old male. Unfortunately, the bleeding was huge. It was compressing the brain. He came in an unconscious state. We took him to theatre within 1 hour when he came, and he was discharged in a conscious state. Third patient is a 53-year-old female, a pillion rider. Again, was not wearing helmet and sustained injury by falling from two-wheeler. She had a large bleed. She came in an unconscious state. We operated, but she was discharged only in that same comatose and unconscious state. Her conscious didn't improve. So the thing that is common in all the three scenarios is road traffic accident, fall from two-wheeler, and all three they were not wearing helmet. So wearing helmet is extremely important. If at all they were wearing, this bleeding would not have happened at all. Second, this is one of the patients that I operated in 2018. 30-year-old male fall from two-wheeler. The brain was actually coming out through the skin. The globe was, that is the eyeball was totally damaged. There are two major vessels supplying the brain, the anterior cerebral arteries, they were also damaged. We operated him immediately and he regained the consciousness eventually. But you can see how beautiful the brain was in the initial picture has been damaged by the trauma. This kind of brain injury is not common in cities like Coimbatore. It is common in large metropolitan cities, the bullet injuries. There are two different patients. The first patient, the pellets have gone into the brain parenchyma and eventually he died. The second patient, the bullet is lodged at the C1 C2 joint. This is one of the most vital areas in the human body. This region is at the junction of brain and spinal cord and it has the vital centers. He recovered, but he required long-term ventilator support. This is another form of injury we call as penetrating brain injury, right? This patient was involved in a fight and there was a sharp penetrating object inserted through his head. It penetrated his eyes and it went inside the brain. So the reason I am showing all these pictures is, the first pictures I told the importance of wearing helmet, and this one, whenever there is any object penetrating through the eyes, in school children this is very common. They play in the classrooms and they will get penetrated by a pencil or sharp pen. So this is very common. So whenever this happens, don't please pull out. You have to come to the hospital immediately. Angiogram should be done. We have to check whether this is penetrating any major blood vessels in the brain. In this patient, ICA, which is one of the major vessels supplying the brain, was injured. This was found out in angiography and we eventually took care of the vessel bleeding first, then we removed this. So this is extremely important. Don't pull out any objects if at all is there, if any penetrating injury happens. So when it comes to brain trauma, as I said earlier, always wear helmet irrespective of the distance they travel. Last week I admitted a patient, he just went for 100 meters from his house with his bike without wearing helmet and he had a major brain bleeding because of trauma. So irrespective of the distance, helmet should be worn. It should be worn properly using buckles, snugly fit, and even pillion riders should wear helmet. And another form of brain injury which I didn't put pictures, fall from head is very common in cities. Particularly children usually fall down from height and they sustain trauma. So precautions should be taken to prevent that. So coming to the next subspecialty of brain surgery, the neuro-oncology or brain tumors. So I will tell you two different scenarios. The first two pictures on the left, 30-year-old male patient, he gradually had progressive loss of vision in both his eyes and eventually he became blind. This happened over a period of 1 year, but he never visited any doctors. And he came to us. There was a huge tumor in the region of pituitary gland, which is nothing but gland at the base of the brain. We operated him. Actually, we operated him twice. Once through endoscope and once transcranially, and he recovered. But his vision never recovered. So the thing I wanted to underline is, whenever any injury happens to the brain or spinal cord, depending upon the age, as the age increases, the recovery potential reduces. So whenever there is any minor symptom, we have to take care of it. The second picture, this MRI is of a neurosurgeon. He is currently the oldest living neurosurgeon in this country. When he was 96 years old, I think that was in the year 2019, when he was reading this newspaper, he had transient blurring of vision. He immediately visited the hospital and when he took MRI, it was a pituitary tumor. So through nasal endoscopic technique, we removed the tumor completely, and he is alive even now. No visual problems. He is completely all right. He is, I think, 100 years. He has crossed 100 years, and he is still alive. So the tumor is the same, but the difference is because of time to reach the hospital.
Good afternoon, everyone. Today I am going to talk about bone health. In today's presentation, I am going to talk about how to diagnose, treat, and prevent osteoporosis. At least by the end of this talk, I hope all of you will know why bone health should matter to you now, and understand the disease process called osteoporosis, how to diagnose, treat, and prevent osteoporosis. So osteoporosis is a silent epidemic in many of the countries. So remember this, osteoporosis is a major problem. Almost 70% of the patients over 65 years with osteoporosis, they have never been screened, and also they don't even know that they are having osteoporosis. So by attending this talk, you are one of the lucky ones. I hope you all will learn for yourself, and also you will teach your friends and family as well. When you see the annual incidence of osteoporosis is a major public health problem. Women are most commonly affected than men. So if you see the incidence, it is much more common than breast cancer, uterine cancer, strokes, and heart attacks. Even if you combine everything combine பண்ணி பார்த்தா அதை விட osteoporosis ரொம்ப காமனா இருக்கு நம்ம இந்தியால. Osteoporosis அப்படினா என்ன அப்படினு பாத்தீங்கன்னா, it's a disease characterized by loss of bone mass that leads to weak and fragile bones that leads to fracture. So if you see, osteoporosis, bone is a living tissue first. அதனால it goes through a continuous process of remodel ஆயிட்டே இருக்கும். இப்போ பாத்தீங்கன்னா இந்த சைடு ரைட் சைடு, this is the normal bone. Normal bone ல பாத்தீங்கன்னா you can see how the bone is thicker and stronger. So it helps in holding up and helps to move around. Whereas there are a lot of factors that can affect the bone health tissue, making it weak and osteoporotic. This side, on the right side, is the osteoporotic bone, which is very much thinner and weaker. So it will not be able to provide strength and to the patients. But the good news is that osteoporosis is very much preventable and treatable. Okay, let's see what are the risk factors which leads to osteoporosis. Bone remodeling. Bone remodeling issue. It is easy to think bone as a hard, lifeless part, but it is a growing, living tissue that is constantly being broken and reformed again. So if you see, there are two cells in the body, osteoblast and osteoclast. Osteoblast helps in bone formation. Osteoclast helps in bone resorption. Okay. The bone remodeling will take place every 7 to 10 years. So the bones that you are having now, that will not be the same that you are having 7 to 10 years back. அதே மாதிரி இப்போ இருக்க போன் வந்து 7 to 10 years கழிச்சு பார்த்தீங்கன்னா அதே போன் இருக்காது. ஏன்னா போன் ரீமாடலிங் கண்டினியூஸ் ஆகிட்டே இருக்கும். ஸோ நம்மளுக்கு ஒரு பாசிபிலிட்டி இருக்கு, நம்ம ஒழுங்காக டயட் எக்ஸசைஸ் எல்லாம் பண்ணா we can improve the bone quality in the near future. அதுதான் because bone remodel continuously remodel ஆகுறதுனால. இப்போ how the bones change throughout the life. இப்போ early childhoodல பார்த்தீங்கன்னா osteoblast bone formation ரொம்ப அதிகமாக இருக்கும். அதனால போன்ஸ்லாம் வந்து ரொம்ப ஸ்ட்ராங்கா அண்ட் ஹெல்த்தியா இருக்கும். அப்படியே அரௌண்ட் ஏஜ் ஆஃப் 30 இயர்ஸ் பார்த்தீங்கன்னா ஒரு பீக் போன் மாஸ் இருக்கும். அது வந்து யூஸ்வலாக அப்படியே மெயின்டைன் ஆகிட்டே இருக்கும் until you attain menopause. Around the 5 years around menopause பார்த்தீங்கன்னா due to decrease in the estrogen level, osteoclast activity will predominate. அதாவது bone resorption ரொம்ப அதிகமாக இருக்கும் bone formation விட. So around 5 years you will lose around 25 to 30% of your total bone mass for female patients. For men's எடுத்துக்கிட்டீங்க அப்படின்னா men's வந்து யூஸ்வலாக they tend to lose bone at a slower and steady rate. At around the age of 70 years என்ன ஆகும் பார்த்தீங்கன்னா அவங்களோட testosterone level கம்மியாகிறதுனால they also tend to lose at higher rate after 70 years. But women's அப்படி இல்லை, menopause around 5 years around menopause the estrogen level கம்மியாகிறதுனால osteoclast activity ரொம்ப predominant-ஆ இருக்கும். அதனால they tend to lose bone loss very early. So what are the factors that affect your bone health? The amount of calcium that you take in your diet, physical inactivity, tobacco and alcohol usage, and female patients are more common. Size-wise, very thin ladies tend to have lower bone mass. And age, when you become aged and your bones become get thicker when you age increases. The race and family history, hormone levels, the estrogen and testosterone level, and eating disorders, and certain medications if you take for long time like steroids, anti-epileptic medications that can lead to weaker bones. So what are the risk factors that you can't change? Genetic factor you can't change. Age, gender, female patients are more common. Fracture or family history, having a history of any fracture in the family, and history of rheumatoid arthritis, they tend to have weaker bones. And some medications like steroids and anti-epileptic medications. The risk factors that you can change: exercise, calcium and vitamin D supplementation, quitting tobacco and reducing the alcohol consumption. You can increase your BMI by taking proper diet, and some medications you should not take for longer time without your doctor's prescription. And excessive intake of caffeine also leads to some bone loss. So screening recommendation, யாருக்கெல்லாம் டெஸ்ட் பண்ணணும் அப்படின்னு பார்த்தீங்கன்னா, all women over 65 years of age, women between 50 to 65 years of age, some with risk factors, men, all men over 70 years, men between 50 to 70 years with some risk factors. சரி, எப்படி நம்ம ஸ்கிரீன் பண்ணி டெஸ்ட் கண்டுபிடிக்கலாம் ஆஸ்டியோபோரோசிஸ் இருக்கா இல்லையான்றது? பிளட் கால்சியம் செக் பண்றதால we can't detect osteoporosis. அதனால அது என்னன்னா, it's a bone mineral density test, அதாவது DEXA scan சொல்லுவோம். இது வந்து is a gold standard for diagnosing the osteoporosis. It measures the how much dense bone எவ்வளவு டென்ஸா இருக்குன்றது ஈஸியா அதை கண்டுபிடிச்சிடலாம். இட் இஸ் யூஸ்ஃபுல் ஸ்கிரீனிங் டெஸ்ட். அண்ட் ஆல்சோ இப்போ நீங்கள் ட்ரீட்மெண்ட் எடுத்துட்டு இருக்கீங்கன்னா, தெரப்பி எவ்வளோ ரெஸ்பான்ஸ் இருக்குன்றது பார்க்கறதுக்கு இந்த போன் மினரல் டென்சிட்டி டெஸ்ட் வந்து ரொம்ப ஹெல்ப்ஃபுல்லாக இருக்கும். இது வந்து இட்ஸ் அன் அவுட் பேஷண்ட் ப்ரொசீஜர் தான். இட்ஸ் லைக் அன் எக்ஸ்ரே தான். இட்ஸ் ஈஸிலி கேன் பி டேக்கன். அண்ட் இது பண்ணுறதுனால ஈஸியாக கேன் டிடெக்ட் ஹவு மச் வீக்கர் யூஆர். எப்படி இப்போ டெக்ஸா ஸ்கேனில் இந்த மாதிரி தான் ரிப்போர்ட் கொடுப்பாங்க. எப்படி இன்டர்பிரேட் பண்ணலாம் அப்படின்னு பார்த்தீங்கன்னா, பேஸ்ட் ஆன் டெக்ஸா ஸ்கேன், நார்மல் அப்படின்னா இட் ஷுட் பி -1 அதிகமாக இருந்தால் நார்மல். If it is between -1 to 2.5, that is low bone density. -2.5 ஓட -3, -4 அப்படிலாம் இருந்தா ஆட்டோமேட்டிக்கா அது ஆஸ்டியோபோரோட்டிக் அப்படின்னு சொல்லுவோம். இம்பார்ட்டன்ஸ் ஆஃப் போன் ஹெல்த் பார்த்தீங்கன்னா, போன் வந்து என்ன நம்ம சப்போர்ட் நம்ம ஆக்டிவா இருக்கிறதுக்கு போன் ரொம்ப ஹெல்ப்ஃபுல்லா இருக்கு. அண்ட் ஆல்சோ இட் ப்ரொடெக்ட்ஸ் வைட்டல் ஆர்கன்ஸ் ஃப்ரம் இன்ஜுரி. இப்போ பிரெயின் இன்ஜுரி ஆகாம இருக்கிறது ஸ்கல் போன் இருக்கு, அது மாதிரி உள்ள ஹார்ட் லங்ஸுக்கு வந்து ரிப் கேஜ்ல இருக்கு. அது மாதிரி போன்ஸ் ப்ரொடெக்ட் த வைட்டல் ஆர்கன்ஸ் ஃப்ரம் இன்ஜுரி. அப்போ போன்ஸ் என்ன பண்ணுன்னா, இட் ஸ்டோர்ஸ் மினரல்ஸ் லைக் கால்சியம் அண்ட் பாஸ்பரஸ். ஆல்மோஸ்ட் 99% ஆஃப் கால்சியம் வந்து போன்ஸ்லயும் டீத்ல தான் இருக்கு. ரிமைனிங் 1% தான் பிளட்ல இருக்கும். போன்ஸ் ஹெல்த்தியா வச்சுக்கணும் அப்படின்னா, யூ ஷுட் ஈட் ஹெல்தி ஃபுட்ஸ், வெல் பேலன்ஸ்டு டயட், ஈட்டிங் ஃபுட்ஸ் ரிச் இன் கால்சியம் அண்ட் விட்டமின் டி, அண்ட் குட் ஹேபிட்ஸ், அவாய்டிங் ஸ்மோக்கிங் அண்ட் ஆல்கஹால், அண்ட் பிசிக்கல் ஆக்டிவிட்டி. இப்போ நீங்க சாப்பிட்றீங்க அப்படின்னா, அந்த பிளேட்ல உங்களுக்கு எல்லாமே இதில் இருக்கணும். கண்டிப்பா ஃப்ரூட்ஸ் இருக்கணும், வெஜிடபிள்ஸ் இருக்கணும், கிரெயின்ஸ், ப்ரோட்டீன்ஸ் அண்ட் டைரி ப்ராடக்ட்ஸ் எல்லாம் இருக்கும். கண்டிப்பா இது எல்லாமே இருந்தால் தான் யூ ஷுட் வெல் பேலன்ஸ்டு டயட். இப்போ டயக்னோசிஸ் எப்படி பண்ணுறதுன்னு பார்த்துட்டோம். ட்ரீட்மெண்ட் பார்த்தீங்கன்னா, இப்போ பேஸ்ட் ஆன் யுவர் டெக்ஸா ஸ்கேன் ரிப்போர்ட் இப்போ வந்து -2.5 -3 இருக்குன்னா, there are some medications to treat osteoporosis. என்னென்ன மெடிகேஷன்? யூஸ்வலாக பிஸ்பாஸ்பனேட்ஸ், டெனோசுமேப், டெரிபாரடைட், அப்புறம் ஹார்மோனல் தெரப்பி, கால்சிட்டோனின் இதெல்லாம் இருக்கு. இது வந்து டிபெண்ட்ஸ் எவ்வளோ சிவியரா யுவர் அஃபெக்டட், அதை பொறுத்து டாக்டர் வில் பிரிஸ்கிரைப் மெடிகேஷன்ஸ். ஒன்லி டேப்லெட்ஸ் மட்டும் பத்தாது. Along with that, calcium, vitamin D supplementation plus exercise. இப்போ டயக்னோசிஸ் ட்ரீட்மெண்ட் பார்த்தாச்சு. எப்படி ப்ரிவென்ட் பண்ணலாம் இந்த போன் லாஸ்? 3 தான் மெயின் 3: கால்சியம், விட்டமின் டி அண்ட் பிசிக்கல் எக்ஸசைஸ். கால்சியம் அப்படின்னு கால்சியம் அண்ட் விட்டமின் டி ரெண்டுமே வந்து சேர்ந்து ஆக்ட் பண்ணும். They work together to maintain and strong bones, improving your bone health and decreasing the risk of fractures. கால்சியம்னா சப்ளிமெண்ட்ஸ் தான் எடுக்கணும் அவசியம் இல்லை. ஃபுட் இஸ் த ஃபர்ஸ்ட் மெயின் சோர்ஸ் that comes to your mind when கால்சியம்னாவே ஃபுட்லயே நிறைய இருக்கு. நம்ம ஃபுட்லயே முடிஞ்ச வரைக்கும் எடுத்து கரெக்ட் பண்ண பார்க்கணும். கால்சியம் என்ன மெயின் இம்பார்ட்டன்ட் திங்னா, கால்சியம் வந்து பாடி ப்ரொடியூஸ் பண்ணாது. நீங்க டயட்ல இருந்தா கண்டிப்பா அது கால்சியம் எடுத்தாகணும். டயட்ல இன்அடிக்குவேட், சப்போஸ் கால்சியம் அடிக்குவேட்டா இல்லை அப்படின்னா, போன்ஸ் இருக்க கால்சியம் வந்து the body will take it out. So it will become automatically osteoporotic ஆயிடுவீங்க. ஆனா பிளட் லெவல் நீங்க கால்சியம் செக் பண்றதுனால ஆஸ்டியோபோரோட்டிக் இல்லைன்னு கண்டுபிடிக்க முடியாது. சரிங்களா? டெக்ஸா ஸ்கேன் தான் கேன் டிடெக்ட். ஸோ டெய்லி ரெக்கமெண்டேஷன் என்னன்னு பார்த்தீங்க அப்படின்னா, அக்கார்டிங் டு நேஷனல் இன்ஸ்டியூட் ஆஃப் ஹெல்த் அண்ட் நேஷனல் ஆஸ்டியோபோரோசிஸ் ஃபவுண்டேஷன், women less than 50 years almost 1000 mg of calcium daily தேவை. more than 50 years almost 1200 mg you have to take daily. சரி, கால்சியம் ரிச் ஃபுட்ஸ் என்னெல்லாம் இருக்கு? நம்ம ஈஸி காமன்லி அவைலபிள் ஃபுட்ஸ் அப்படின்னு பார்த்தீங்கன்னா, மில்க் அண்ட் மில்க் ப்ராடக்ட்ஸ் தான் கால்சியம் இருக்கு. சப்போஸ் ஒரு 100 ml மில்க் குடிக்கிறீங்க அப்படின்னா, it will give 128 mg of calcium. ஒரு 250 ml ஒரு நாளைக்கு டெய்லி குடிக்கிறீங்க அப்படின்னா, it will give around 300 mg of calcium it will provide. அடுத்து என்னென்ன இருக்குன்னா, ராகி வந்து ரொம்ப இம்பார்ட்டன்ட் ஃபுட் டு கிவ் கால்சியம். ரொம்ப அதிகமாக இருக்கு ஃபுட் பார்த்தீங்கன்னா, ராகில ரொம்ப அதிகமாக இருக்கு. எப்படின்னா ஒரு 100 கிராம்ல வந்து எவ்வளோ இருக்கு பார்த்தீங்கன்னா 344 mg இருக்கு. ராகி கூழ் சாப்பிடலாம், இல்லைன்னா ராகி தோசை. ஒரு ராகி தோசைல ஆல்மோஸ்ட் 70 mg இருக்கு. இப்போ 2 ராகி தோசை சாப்பிட்டீங்கன்னா ஒரு 150 mg உங்களுக்கு கால்சியம் ஈஸியாக கிடைக்கும். ஒரு ஃபிஷ்ல பார்த்தீங்கன்னா, சர்டைன் மத்தி மீன்ல வந்து பார்த்தீங்கன்னா ரொம்ப கால்சியம் அதிகமாக இருக்கு. அப்புறம் ஆல்மண்ட்ஸில் 100 கிராமில் 260 மில்லிகிராம் ஆஃப் கால்சியம் இருக்குது. இப்போ மில்க் ப்ராடக்ட்ஸ் தவிர வேறு எதில் அதிகமாக இருக்குன்னு பார்த்தீங்கன்னா க்ரீன் லீஃபி வெஜிடபிள்ஸ், அதில் ரொம்ப கால்சியம் அதிகமாக இருக்குது. ஸ்பினாச்சில் பார்த்தீங்கன்னா 100 மில்லிகிராம் இருக்குது. சீஸில் ஆல்மோஸ்ட் இட் கிவ்ஸ் 790 மில்லிகிராம் ஆஃப் கால்சியம் இருக்குது. அமரந்த் அப்படின்னா ஒரு சிறுகீரை, முளைக்கீரை, அதில் பார்த்தீங்கன்னா கால்சியம் அதிகமாக இருக்குது. அண்ட் மோஸ்ட் இம்பார்ட்டன்ட் திங் ட்ரம்ஸ்டிக், முருங்கைக்கீரையில் ரொம்ப கால்சியம் அதிகமாக இருக்குது. யூ கேன் டேக் முருங்கைக்கீரை சூப் குடிக்கிறது ரொம்ப பெனிஃபிட் அதிகமாக இருக்குது. அதை தவிர வேறு என்னெல்லாம் இருக்குன்னு பார்த்தீங்கன்னா பன்னீரில் 475 மில்லிகிராம் இருக்குது. சோயா சங்க்ஸில் 300 மில்லிகிராம் இருக்குது. செசேம் சீட்ஸ், எள்ளில் நிறைய கால்சியம் இருக்குது. யூ கேன் டேக் எள்ளு உருண்டை அது மாதிரி எடுத்துக்கலாம். அப்புறம் மின்ட் லீவ்ஸ், புதினாலையும் பார்த்தீங்கன்னா 205 மில்லிகிராம் இருக்குது. இப்போ என்னென்ன மெயினாக பார்த்தீங்க அப்படின்னா மில்க் அண்ட் மில்க் ப்ராடக்ட்ஸில் கால்சியம் அதிகமாக இருக்குது. ஃபிஷ் ஒரு சைடாக சல்மான் ஃபிஷ், சடன் ஃபிஷ்ல ரொம்ப அதிகமாக இருக்குது. அதுக்கப்புறம் க்ரீன் லீஃப் வெஜிடபிள்ஸில் ரொம்ப கால்சியம் இருக்குது. சப்போஸ் இதெல்லாம் இல்லை அப்படின்ற பட்சத்தில் நம்ம கால்சியம் சப்ளிமெண்ட்ஸ் டேப்லெட்ஸ் எடுத்துக்கலாம். கால்சியம் டேப்லெட்ஸ் வந்து 2 ஃபார்ம்ஸில் அவைலபிளாக இருக்குது. ஒன்று வந்து கால்சியம் சிட்ரேட்டு, இன்னொன்று கால்சியம் கார்பனேட். கால்சியம் கார்பனேட் வந்து லெஸ் எக்ஸ்பென்சிவ், அதில் எலிமெண்டல் கால்சியம் அதிகமாக இருக்குது. பட் என்னன்னா அது வந்து நீங்கள் எம்டி ஸ்டொமக்கில் அதை எடுக்க முடியாது. யூ ஹேவ் டு டேக் அலாங் வித் ஃபுட் தான் எடுக்கணும். பட் கால்சியம் சிட்ரேட் வந்து அந்த மாதிரி ப்ராப்ளம் இல்லை. யூ கேன் ஈஸிலி டேக் எனி டைம் வித்வுட் ஃபுட் கூட எடுத்துக்கலாம். பட் லிட்டில் பிட் கொஞ்சம் கால்சியம் உங்களுக்கு எது சூட் ஆகுதோ அதுதான் பெஸ்ட் கால்சியம். யூ கேன் டேக் ஆல் அலாங் யுவர் லைஃப்.
I would like to thank the management and the faculty for giving me an opportunity. And I joined here recently, and it's almost 1.5 months. And this is my first presentation. So most of times, what we know is regarding the pulmonary medicine, we are very much familiar about the diagnosis of asthma, or whatever we say. Mostly when someone has a breathlessness or is not feeling good, having cough and other things, we suggest it could be an asthma. So there are some other diseases which are beyond asthma, which are being treated by the pulmonologists, and many of them will not be known as such initially, but later on we'll be going for the diagnosis. So I thought that it will be useful for you to have an insight about some other diseases which are also having similar presentation. So usually there will be a famous saying, it said as not all the wheeze are asthma. That's true. So whenever an individual presents with wheeze, we immediately say it could be an asthma. Wheezing oda vararu asthma vada irukum அப்படிங்கறத most of the time சொல்றோம். பட் அப்படி இருக்காதுங்க. மூச்சு வாங்குறது அப்படிங்கிறது வேற. மூச்சு வாங்குறதுல உள்ள அந்த noisy breathing தான் நம்ம wheezing சொல்றோம். So when it comes for a noisy breathing with wheeze, it is due to various other reasons. Sometimes அது வந்து pulmonary reason இருக்கலாம். சில நேரத்துல pulmonology issues இல்லாம cardiac reason கூட இருக்கிறதுக்கு வாய்ப்புகள் இருக்குங்க. And இப்போ latest நமக்கு நிறைய advancements இருக்கனால we are able to identify the diseases early and we are able to treat them accordingly. And so topic நான் வந்து beyond asthma போட்டாலோ it will not be ideal for me to go without touching asthma. Asthma is more common and more prevalent. Many of the individuals are diagnosed in their childhood. Some of them are diagnosed during their adolescence and some of them in the late age also. So depending on the presentation, we just treat the individuals accordingly. And for some data, it happens for about 13.09% of the global burden. And as per estimated, it's about 34.3 million individuals are being affected by asthma. So this is basically due to an allergy. Allergy regarding the respiratory tract most commonly. So allergy can manifest either as a skin allergy, food allergy or anything else. Basically, initially this allergy, they will be having presentation with manifestations like atopic dermatitis.